hard points on the end, a soft swab, pen line, stethoscope. Did I miss anything? Okay. And as needed, gloves. If you need, you'll be needing gloves for part of it. So basically, as you know, you can demonstrate most of it, but some of it we just ask that you just tell us about. So I would say I have cleansed my hands, I've introduced myself to the client, and I've had her step up on the scale so I could get her height and weight. I've also done the Snellen acuity testing with her, and we've accomplished that. We've also done the vital signs, and I've assessed her for pain. I'll continue to assess her for pain throughout the whole exam. And then as I saw her get up on the scale, I noticed that she was coordinated, she could follow directions, she was able to follow directions and also respond appropriately. So I would ask her to assess her orientation and arousal. Do you know your name? Do you know where you're at? Okay, do you know what time it is?
Like 9:15.
Okay, and can you tell me what time it is there?
9:07.
9:07, okay, and do you know why you're here, the situation?
I'm being assessed.
Okay, so I've checked the alert and oriented times 4, and then I slipped in if she could tell me what time it was on the clock, which was cognition. So she was able to tell me what time it was, or I could have done a simple math equation and also check for thinking in that. So then I would ask her to remember 3 words, and then try to remember to ask her those words last time. I don't recall that I did that, but anyway, so we could say, remember these 3 words, and then at the end of the exam say, do you remember those 3 words? Today I think what I'll do is I'll say, so for short-term memory, what did you have for breakfast?
A muffin.
A muffin, okay. And what did you have, or let's say, what did you do a year ago in the summertime for long-term memory?
I was in Canada.
Okay. So she's demonstrated thinking, she's demonstrated memory intact, short and long term. Her language is clear, she's comprehensible. Her facial expression is alert, and she seems engaged. Her attention and concentration is appropriate as I'm asking her the questions. So in assessing for mental status, I think I've knocked out quite a bit of what's required. Her behavior is calm, so I would also address her behavior as well. And then noticing her physical appearance is clean and neat, and she's wearing appropriate attire for the event. So at that point, then I would say what I'd like to do today is assess you from head to toe. So is it all right if I touch your skin? So then I would begin by touching her skin and feeling the temperature, the warmth. I could also pinch for capillary refill, and in the interest of time, I'm only going to do one side, but I would normally do both sides. So then I would also ask her, is any of this area that I'm touching tender? When I touch you, let me know if it is tender. So I'll also check your scalp now. So looking at her hair, I notice her hair is clean. There are no nits. There are no parasites. I don't see any breakdown in the scalp. As I part the hair, I don't see any nits or dandruff. And again, as you talk through your exam, as you work through your exam, you're going to be talking to us about what it is you're assessing for and why you're doing that. So her hair is without breakage, there's no alopecia. So I'm saying a lot of different things I'm looking for, but if you can come up with 1 or 2 things, that's fine. I'm giving you some ideas though, and just trying to come up with a variety of things to talk about. So in addition to checking the capillary refill of the upper extremities, then I would also check the capillary refill of the lower extremities, pinching and reviewing for blanching. So noticing as she's sitting in the chair that she is symmetrical, her head is erect, she's sitting straight. Looking at her neck, there is symmetry. I don't see any masses or scars. Also, letting her know that I would like to palpate her head and neck for the lymph nodes as well as the thyroid. Is that okay? All right, so I'll start from the back. You guys tell me what I'm feeling here. Which ones are these? Occipital. What about these? Post-auricular. And while I'm here, I could also feel the mastoid area. All right. Preauricular. You could, there's even the tonsillar here. I think, isn't that listed, the tonsillar? All right, and then what are these? Submandibular. This is submental. All right, and then we're going to take the superficial cervical chain down to the clavicle, posterior cervical chain, and deep in between the musculature there, the deep cervical chain. And while I'm here, I'll also do the supra and inferior areas of the clavicle. Look, feeling for any tenderness. Any tenderness, enlargement, I didn't feel any heat. So those are the things I'm feeling for. Also, we'll check your thyroid. So I'll have you just swallow. See the movement of the thyroid. I'll push to one side and palpate the lobes. Push it to the other side and palpate the lobe. And I notice bilateral, equality, no hardness, no nodules noted. Any tenderness with that? Okay. All right, so now I could ask her to give me some facial expression, which I could say, go ahead and frown, smile, puff your cheeks, raise your eyebrows. Okay, so that lets me know her cranial nerve. Which one is it? 7. That's intact. And then also I would check to see if her cranial nerve, which one will this be? I'm going to check for sensation on her face. 5. That's right, which is your trigeminal. You've got your facial for the 7th. Trigeminal is 5. Okay, so if you close your eyes, let me know if you feel this soft touch. Okay? All right, and again. Okay, good. So she's able to feel the soft touch. And then now as I look at her, I'm talking to her, I'll also notice that her eyes are equal bilaterally. They're in alignment. They're appropriately spaced at the level of the ears. Her eyebrows are without alopecia. There are no knits or scars noted in there. I see her lashes are full and equal. There are no bare spots or vacancies of the lashes. Her sclera is white. Her cornea is clear. Her iris is a hazel green. Her pupils are equal, and I'm going to check for perla. I don't see any redness of the conjunctiva. I don't see any drainage. Did I hit all the structures of the eyes? Did I miss anything? Oh, the lids are without swelling. So, and that many times that's where we would see swelling, is in the lids and around the eyes. Okay, so speaking to the eyes specifically, and then I could ask her to follow my finger, and I would do the 6 cardinal fields of gaze. And then which cranial nerves would I be testing? You guys remember?
2,
3, 4, 6. According to this, you've got 3, 4, 6, and then 2 would be accomplished when we did the acuity, the smell and acuity. And also Perla will do 3, 4, and 6. So those 2 combined will do 3, 4, and 6. All right, so I'll just have her follow my finger out. Just use your peripheral vision without moving your head. Very good. All right, and then we'll do the perla. So I would dim the light, and I would ask her to look ahead, and I would come from the side and shine my light into her eyes. I'll do it a couple times so I'm sure of what I'm seeing here. They both are equal, round, reactive to light. And then I would ask her to just follow out my pen light. And I see how her eyes dilate to follow it far away and constrict, so also to accommodation. So I could say perla. All right. Stop me if you have any questions. So then we move to the ear. We would check the pinna, so I'll touch your ear, the pinna and the tragus. Any tenderness with that? I've already touched the mastoid and didn't feel any softness or issues with that. And then I'll test with the gross whisper test. So I'll stand behind you and have you cover your right ear. So I'll test the left ear by whispering. What did you hear?
Rain.
Okay. Cover your left ear and we'll test the right ear by saying, what did you hear?
I couldn't hear you.
Okay. So we'll do it again.
Sunshine.
Okay. Good. That's why you couldn't hear me, because it's raining like crazy out there. So the gross whisper test, she's equal bilaterally with no difficulties if I speak clearly. Okay, so then the next thing, we look at the nose on the face and we say the nose is straight in alignment. There are no deformities or deviations. It's symmetrical. I see the nares are without redness or drainage, and I would also shine the light in the nares looking for any redness or excessive drainage. Which reminds me, and you can do this in your exam, I didn't shine the light in the ear canal. You guys didn't catch me. So I would shine the light in the ear canal, also looking for foreign bodies, drainage, or anything like that. So, and that's very common where we're doing something, we're like, oh, I forgot. And that's not going to count against you in your exam. Just be sure you state, oh, I missed that, so I want to demonstrate it right now. And then also percussing the frontal and maxillary sinuses. So I'm going to tap your face. Let me know if you have any pain with this. Right on the forehead and underneath the eye, right on the cheekbone. Any pain? Okay, so that's a direct percussion that you would use in your exam. All right, so then we'll go to the mouth area, and looking at her mouth, her lips are symmetrical, there's no lesions, there's no cracking. We'll have her open her mouth and stick out her tongue and say, ah. Which two cranial nerves is she going to exhibit for me here? Stick out your tongue and say, ah. You gotta say, ah. Because that'll lift the palate, and then just stick that tongue right out at me. There you go. That's the way to examine the pharynx. And then when you say ah, the palate lifts and you can get a good visualization of the back of the throat there. So her throat and pharynx were without redness. I'm trying to remember if I saw tonsils in there. No, I didn't see any tonsils, and also no exudate. So looking at that, the uvula was midline, the palate lifted equally, symmetrically when she said ah. Let's see. So her tongue was straight when she projected it out. Her teeth, I did not see any decay, and they were in alignment. I didn't see any broken teeth. Her mucosa was moist, pink. Okay, so we've touched on all those things that you want to talk about. One other thing is I'm going to feel your parotid glands, which will be on the outside, and then I'll have to assess under your tongue. So we'll palpate the parotid glands. Any pain with that? All right, and then when you stick, if you open your mouth and then lift your tongue, you don't have to say ah, but just lift your tongue. There you go. I see that the submandibular glands are without redness or drainage at those pinpoint. They're just teeny little openings that you'll see when you shine the light down there. Okay, I think we caught it all. Did you guys see if I missed anything? Okay. All right, so then the next thing we would do is move to the pulmonary. So at this point, you could move to the pulmonary, but we have a few things we could kind of finish out regarding neuro and musculoskeletal. So while she's in the chair, I think I'm going to go ahead and do that and just take care of all that stuff right now, and then when the patient goes to the bed, that'll be the end of that. So for example, what I would like to do is take one of these, and what we start out with is the soft touch and hard sensation. So this is considered the superficial sensation on the upper and lower extremities. So if I have her hold her hand out and close her eyes, then I'll have her tell me if she can feel hardness or softness when I touch her here.
Hard.
Okay,
Soft.
all right.
Hard.
All right, so she doesn't seem to have any, yeah, these are a little hard on the end. But she doesn't seem to have any deficit, so I would do that on both sides. I would also demonstrate it on the feet. So I'd start at the toe, closing your eyes. Is it hard or soft? And we can just mock this up.
Hard.
Okay,
Hard.
all right. Okay, so she doesn't have any deficit. She's able to feel to the tip of her fingers as well as the tip of her toes. So that would be testing that. And then I didn't bring a specific item, but I'll just have you close your eyes and you can tell me what kind of item you can feel in your hand here.
Feels like a cotton ball.
All right, good. So a cotton ball, and I would do that on both sides. Also, let me draw something in your hand. You tell me what it is. It's going to be a letter or a number.
3.
Okay, so she's able to discern stereognosis, which is feeling something, and graphesthesia, which is determining a symbol in her hand. So we did assess the sensory piece. Then what we want to do is the motor piece, which is I can speak to her posture and gait when she walked in the room, when she got on the scale, and all of that was coordinated, balanced. She looks to me as if she has good muscle tone. And I don't see any involuntary movements or drifting, but let's have her stand up and we'll do the Romberg, which I wanted to verify with you that a positive Romberg is what you would document if somebody had abnormalities. So if you close your eyes and then just let's see if she sways one way or another. If she sways, that's considered a positive Romberg. She's not swaying, so this is a negative Romberg. Thank you. And then while you're standing, I'm going to also have you walk through some range of motion with me. Okay. So you can face me and kind of just do what I do. So I'd like to assess your range of motion in your upper arms. So if you put your arms out at your side, can you also put your arms behind your head? And then your lower waist, okay. And then put them out like that. And then can you supinate and pronate? So we're getting, and then can you bring your arms to yourself? Okay, very good. And so your spine, go to the sides. All right, do you have any pain with this? Go and lean forward, okay, and I could be behind her at that time and checking for scoliosis as she leans forward. Any pain with that at all? All right, while we're thinking of the spine, we should think about the neck. So we'll have you reach side to side, up. Any trouble with that? And down. Okay, good. And that's the other thing, you know, you want to see what your client is doing, so kind of observing that. So we've got the upper, we've got the spine. Now let's do the hip. So if you lift up your knee and open it out, is this painful in your hip or in your knee? And then you could do some circles with your ankle. All right, so that would be a way of assessing the lower extremity. Any questions or thoughts on the range of motion? All right, now I'll have you sit down. What we'll do is we'll test now for muscle strength, which is a little bit different. So I'll have you lay your arms, or let's extend your arms out to the side. Let's bring you a little further away from that so you don't dash your arm. Okay. All right, and then I'll press down. Don't let me press down. Good strength. I'll press up. Don't let me press up. Okay, and then bring your arms out in front of you. Any problems with that? Okay, and then you can also clamp your fingers and don't let me pull them open, and then extend your fingers, but don't let me close them. So I'm assessing not only muscle strength, but also some range of motion in the hands as well. And then the lower extremities, don't let me pull your legs out. Don't let me push your legs back. Don't let me push your feet down. That would be the pushes and pulls, and don't let me push your foot up. There you go. So you can do pushes and pulls in the chair or also in bed, and you just have them push and pull against you. So either method is acceptable. Let's do the finger grips. So you grip equal, great. Okay, so she has great bilateral upper and lower extremity strength. Any questions on anything so far? Make sure. Now, what am I missing? What else do I need to do for musculoskeletal? That's right. We've got to do, we did the upper extremities, but we need to do the joints. We want to palpate all those joints, and that's a big part of this exam, too. It just is a one-sentence thing, but it's quite a bit. So, let me find some cleanser because I was touching your feet.
Right there.
Where is it?
Right here behind us.
Oh, okay. Great. So, because what I want to do now is check the TMJ. Who can tell me how I should assess the TMJ? What do I need to do for that?
Listen for clicking.
Okay, so I palpate it and have her open her jaw. Go ahead. And I'm feeling for clicking close or any irregularities. Okay, good. Now what I'm going to do is when you open your jaw, I'm going to kind of push against it. Open your jaw. Any resistance or pain as I do that? No? Okay, so I'm checking the strength of the TMJ as well as the joint itself, and no issues there. And another thing you can do while they're doing that range of motion, you could have been palpating all the joints, but at this time I'm going to just have her stand up and I'll just palpate her joints as we're talking. So do you have any pain or tenderness in here? Go ahead and move your arms out at your side, and I can feel if there's any crepitus. Go ahead and bring your elbows in. Okay, and then kind of move your wrists in circles, right? All right, so I'm assessing those joints. I would also assess the spinal process, making sure there's no tenderness. What else am I looking for with the spinal process? Curvature, masses, tenderness, ecchymosis. All right. And then how about your hips? Are you having any pain in your hips? If you lift one leg at a time, I can feel for crepitus. All right. And then the same with the knees. If you bend your knee one at a time, I can also feel for crepitus. Good. And then when she sits down, I can assess her her ankles. So we can do that at that time. So go ahead and twist your ankles in circles, okay? So no edema, no difficulty, no tenderness with that. And I didn't feel any crepitus with anything either. So, all right. I think at this point I've gotten through the stand-up, sit-down stuff. Then I would move to the patient laying down. So, thank you. All right, so I'll move now to the next part of the exam with the patient laying down. Oh, the gag reflex is which cranial nerve? No, it's cranial nerve 9. And what we want to do is we want to test that, but a lot of times the students like to wait till the very end. So you can certainly do that at the very end because sometimes it upsets the patient's stomach. So don't forget to do the cranial nerve 9 assessment.
Do we have to say the name of the cranial nerve or just the number?
You want to say the number for sure, but some students like to learn them both together. It just helps them to learn it. So, it's important that you understand which one you are testing. Okay, so as we move into the patient laying in the bed here, I would say, okay, Mr. Jones, now what I need to do next is we need to listen to your heart and lungs. So I'm going to bring your head up just a little bit as we do the heart and lungs. So as I'm bringing the head of the bed up, I can be inspecting the thorax for rhythm, respiratory quality, and rate. I notice that the patient is breathing shallow, regular, at a rate of approximately 12 per minute. I've already assessed the lymph nodes. And now what I'd like to do is just have the patient let me listen to their heart and lungs. Whoops. So let's have you take some good deep breaths, Mr. Jones. And again, for the purposes of the exam, you don't have to put your ears in your ears. Deep breath, in and out, starting at the level of the scapula, then going down and comparing side to side. With each respiration is an inhalation, exhalation, and then moving the stethoscope. Once they've inhaled and exhaled, then moving the stethoscope. Each time it would be under the clothing, but to kind of show you where to put the stethoscope, I'm just leaving the gown on here. All right, so she takes another deep breath for me. He takes another deep breath for me, but I think it's a Ms. Jones. What's that?
Is that 8 total in front?
You're looking at least 6 on each side. So you're looking at probably 12. 1, 2, 3, 4, 5, 6, 7, 8. Well, in this, she's got a little bit smaller chest, so I was able to accomplish what I needed with 8. And so, but anywhere from 8 to 12, depending on the level of the chest, on the size of the chest. And at that time, then I would also let the patient know that I would like to check for phrenitis, which could be done on the back side of their chest, and then the percussion, which would be done on the back side of their chest. And so because he's hard to position, I can demonstrate that on Mr. Bones or something at the end here. So then we want to talk to him about his jugular veins. And so I'm going to be looking at his jugular veins. I start on the right side. Can you guys tell me again why we would start on the right side, looking for the jugular vein distension? It's one of the earliest signs of right-sided heart failure or an extra fluid buildup, and we'll see it backing up on the right side. So I would have the patient turn their head away. You can also use a pen light to shine the light at the neck veins, and sometimes they cast a bit of a shadow if they're enlarged or distended. So you can actually shine the light at the neck vein and say, that there is no shadowing based on the congenital light as you're shining it at the neck. I don't see any enlarged or distended veins, but if I did, I would measure at the level of the clavicle to the level of the height of the distension. Also at this time, I will be looking at the carotid arteries, both sides, for pulsation, and also palpating the carotid arteries one at a time for palpation, for equality and pulsation. And then I will also flip my stethoscope over to the bell and auscultate. What am I listening for?
Bruise.
Bruise. And I don't hear any swooshing sounds on Mr. Jones today. What else do I need to do? You guys remember? I have to keep referring to my sheet. Okay, so I want to look at his face. Now I've checked the neck veins, looking at the face, making sure there's no swelling in the face or the arms or the hands or the lower extremities. So I would assess for swelling on both sides of the body for that. Also, I would compare the radial pulses to each other, and they are equal and strong bilaterally, and then the pedal pulses, equal and strong bilaterally. So those are the bare bones. We're looking for at least 2 pulses to be compared peripherally. Then I want to talk to the patient about listening to their heart tones. So you guys tell me, where do I put my stethoscope for the heart tones?
Next to the clavicle between the second and third rib.
It's the second intercostal space on the right, so I would feel to the second intercostal space on the right. What valve sound is that? The aorta. Then what's the side, what do I do on this side?
Same space on the other side of the sternum.
So second intercostal space on the left, and what is the valve? Pulmonic. Then the next space is where?
Herb's point.
Erb's point, which is the third intercostal space along the sternum. And that's a culmination of all the heart sounds. You hear that pretty good right there. And then fourth intercostal space along the sternum. What am I listening for there? A tricuspid, right. To man, if you remember that mnemonic, which I won't go there. And then mid-clavicular line. What am I listening to here? Fourth or fifth intercostal space? Well, you can say fourth or fifth depending on the size of the heart. What valve?
That's the mitral.
Man, right, to mitral. Very good. So, A, P, E, T, M. If that helps you to remember that. Okay, so I would do this in sitting, and then I would also lay the patient flat. But before I want to do that, I want to make sure there's not something else I need to do. Oh, at the end here, when I am listening to the mitral valve, I will also do what?
Compare
the radial pulse to the apical pulse. Why do I do something like that?
Make sure the heart's pumping blood.
So to make sure that each contraction is actually perfusing. You're right. So you check to make sure that you feel equal perfusion throughout. Okay, so then I would go ahead and have him lay down, and I could do those 5 spots again. And in the interest of time, we won't go through that again, but you would just see me placing it in the same place, verbalizing the same things we just talked about, what I'm listening to. And then what you want to say at the end is that the cardiac rate was regular. There was an S1, S2 without extra sounds or murmurs noted. So you want to make sure that you do indicate that once you've assessed. Now that we have the patient laying flat, I would like to assess the abdomen. This is probably the best position. Why is that? Why is it the best position to assess the patient in laying flat? The abdomen is more visible. It's not crunched together. You're going to be able to do a better assessment that way. All right, what's the first thing I do with the abdomen? Do I touch it? All right, what's my first thing?
Inspect.
Inspect. All right, Mr. Jones, I'm just going to pull up your gown and take a look at your abdomen. Oh, you had some surgery here. How's that doing? How's your pain level? So you ask all that. So I'm inspecting, and then what do I do? Listen. All right, so I don't see any bleeding. I do see the incision. I'm going to make sure I've got it on the diaphragm, and then I'm going to listen in all 4 quadrants for bowel sounds. What do we listen for? What's the terminology we use for bowel sounds? Do you remember? Hyper, hypo, or active. So his bowel sounds, having had surgery, very hypo. In fact, in this one quadrant, after listening for 3 minutes, I didn't even hear one squeak. But, so I'll chart that. Times 4 quadrants, right? Then while I'm over here, I would also tell the patient, now I need to touch your abdomen, so let me know if you're feeling any pain. So light palpation, how far do we palpate, or how far do we go with light palpation?
2 centimeters.
About 2 centimeters, okay. Now deep palpation, this might hurt you, Mr. Jones, you just had that surgery, okay.